And now joining us is In Focus health correspondent Lino Madu. Welcome again to In Focus.
Thank you so much. It's good to be here.
What do you have for us today?
Well, today we continue to look at the cholera outbreak in Zimbabwe, and international aid agencies are focusing on Zimbabwe to help fight its cholera epidemic. But the death toll, however, keeps rising. Here's the story. The National Federation of the Red Cross says the cholera epidemic in Zimbabwe is approaching what it calls a nightmare scenario, with almost 50,000 cases reported and nearly 3,000 deaths. And now there are fears that Zimbabwe's rainy season will make matters worse. Tony Durham is a spokesman for the international charity ActionAid.
It's likely to get worse because the rain is falling, there could soon be floods, and the problem with floods is that not just that you're surrounded by filthy water and sewage everywhere, but you're cut off from any sources of fresh water that you might have had. So that's a disastrous situation if infections like cholera are already around.
Cholera is a containable waterborne disease, and heavy rains are common in Zimbabwe in January and February. It causes severe diarrhea and dehydration and has spread to all of the country's 10 provinces.
The numbers of cases are going up, the numbers of deaths are going up, it's not under control, and this is one of the worst cholera outbreaks we've seen in Africa for years.
In Harare, ActionAid has provided training in basic cholera prevention and hygiene to 8 partner organizations that cover most of the high-density residential areas. They have been spreading simple messages about safe water, hand washing, food preparation, toilets, and what to do when someone shows symptoms of cholera. Lino Mudu, VOA News. Well, joining us via phone from Harare, Zimbabwe, to give us an update on the cholera epidemic is Robert Mukundinwa. He's a reporter with the Sunday Mail. Robert, thank you so much for joining us on In Focus.
Thank you for having me, Lenore.
Listen, we're talking about almost 3,000 deaths with regards to this epidemic. What is happening on the ground? Why is this crisis not being contained so far?
Well, I would actually think we've had cholera in Zimbabwe as a recurrent problem year after year, and the Minister of Health, Dr. David Parinyatwa, actually mentioned that it's an annual problem we have, and now it's coming twice a year. The only problem is it came at a time where there were a lot of challenges in the country in terms of basic infrastructure and the provision of clean water. And basically, in the absence of clean water, you are bound to have a catastrophe when a disease like cholera crops up. And so, because there was erratic supply of clean water in the urban areas, which are very congested, we've got, for example, in Harare, something over 1 million inhabitants in Harare, and most of those live in the high-density suburbs. And because there was a erratic water supply there, the problem became exacerbated. Originally, whenever a cholera came around, it would be in small places like a place called Epworth, where there is little running water and it's at the periphery of the city, so it's not exactly urban. But this time around, even urban areas didn't have clean water running constantly and consistently, so that actually made the problem very difficult to contain.
But Robert, there have been also several reports about the healthcare system failing in Zimbabwe. Tell us how this could have been, could have made it even more challenging to contain this epidemic.
Well, that is a factor indeed, because at the time when basically the nurses and the doctors were needed desperately by the system, they were on strike right around that time when the outbreak started. And so whilst the people could not even contain the disease back at home because they didn't have basic running water and the real small basics that help them, rehydrate. On the other hand, the referral centers were very challenged in terms of human resources. There were no nurses, no doctors, as they were on industrial action, and so so that came together and
Okay.
was a very, very big challenge.
Okay, well, thank you so much. That's all the time we have today, but we thank you for joining us and do hope that everything indeed works out. Thank you so much, Robert.
We hope so too, and thank you for having me on the program.
Great. And that was an update on this issue.
That's good. Thank you very much, Lenore, for joining us today.
Of
So be sure to watch for Lenore Mudu every Tuesday and Thursday for the latest health news in Africa right here on In Focus.
And for more news on these stories, please go to voanews.com/TV to Africa.